I work on activities of daily living. So things like getting dressed in the morning, using the toilet, taking a shower, and cooking a meal for yourself. I do this through analyzing a patient's arm function and hand function. So things like how the arm moves, how coordinated it is, and its grip strength. I also do activity modification and sort of analysis of an activity to improve the patient's performance when doing that task. I work with people that have had strokes or head injuries, as well as anyone who has any sort of orthopedic concern, as well as patients with chronic pain. I would treat a patient with chronic pain using activity modification. So this is things like kind of walking the patient through their daily activities, things like getting dressed and analyzing where they put their clothes, such as in a high dresser or a low dresser, high up in a closet or low in a closet, and then modifying those things to make it easier on the patient to reduce their level of pain. I would also teach the patient energy conservation principles, which is a fancy word for doing things in a sort of more organized and efficient manner in order for the patient to get through the task with less pain and less time. So this would include things like having commonly used objects kind of left out on the countertop rather than having to go up into a cupboard to retrieve the objects and bring them down to the counter. The patient would leave the object out on the countertop and then use that more frequently to again reduce that chronic pain of that motion of retrieving the object from inside the cupboard. So I'm going to show you here how to get your shoe on without bending at the back so you prevent that chronic back pain from happening, okay? You're going to take this reacher here, and can you grab sort of the tongue of the shoe and bring it closer to you without bending your back? There you go. And then let's change hands here, and you can slip that shoehorn in the heel of the shoe, bring it close, and then slide that foot in there using that shoehorn without bending at the back. And how did that feel?
Better.
All right.